Me and my team are responsible for leading the Rethinking Clinical Trials program, known as the REACT program, which is Canada's largest pragmatic trials program. With REACT, our goal is to do trials that matter to patients. We design our trials with feedback from our patients, and we ask our patients, given the treatment that you've had, what are the side effects or what are the ways that we give treatment that we can actually do research to give you the best treatment, not just the best treatment in Ottawa, but the best treatment in the world. In order to perform such cutting edge and groundbreaking research, we need a team. We need multiple players in this team, and we need to use each other's strengths and sometimes weaknesses to help us do the best thing possible for our patients. We're very lucky here in Ottawa that within the Method Centre we have an incredible infrastructure for helping us not only design our trials, but to analyse our trials and get the results out there so that we can actually not just do research for the sake of research, but do research that actually matters. One trial that we recently completed followed feedback from patients about nausea coming from chemotherapy for breast cancer. And despite all advances in the treatment of this disease, nausea remains a pervasive issue for patients. So the REACT program performed the world's first trial to actually use a mathematical model to calculate what is a patient's individual risk of having nausea with chemotherapy, and can we design the anti-nausea treatments ahead of time to stop them getting nausea in the first place. We recently completed this trial and it was an amazing success, and the results have been implemented immediately into the treatment of all patients coming through the program. So this is an example of doing trials that matter. Patients tell us what's wrong, and we design a trial to answer those questions. When I started my career 30 years ago, treating breast cancer was extremely challenging. The cancers were larger, the treatments were less effective, and the majority of patients died of their disease. Because of research, we have totally turned that round. The vast majority of patients are now cured, and I think it's our mandate as healthcare professionals and a hospital like the Ottawa Hospital is to not be complacent. We must continue doing research that improves the outcomes of our patients so that they can get back on with their lives and live the lives they want to live.